Hi, thank you for watching our educational video on how to administer fluids at home. First, you'll need needed supplies such as your bag of fluids, your fluid line set, and needles. Next, we're going to show you how to set up the whole fluid set and how to bleed the line so that you're prepared to administer fluids to your pet. So first, we're opening the bag. We're going to open our fluid line, and then we'll show you how to bleed the line. This bag set should last anywhere between 4 to 10 times depending on your pet's dose and how often you're administering fluids per week. So first, you'll see here we're going to remove the lid from the spike on the fluid line. We're going to remove the blue rubber tip from the fluid bag, and we're going to insert the spike into the fluid bag right where we removed the blue rubber cover. Next, we're showing you the roller clamp. Okay, so she's inverting the bag and filling the chamber with fluids and then unrolling the roller clamp so that the fluid can flow freely. And then you can just put the fluid line in your sink or a trash can and bleed the line, as we are doing here. And once that line is bled, you are almost ready to administer fluids. We're also going to show you how to attach the needle to the end of the fluid line. So you will replace the needle each time you give fluids. So here we're just going to push the needle onto the fluid line and twist up on the hub. And then we're also going to show you again how you open the line with the roller clamp and close the line with the roller clamp. And that's how you will start and stop the fluids during the fluid administration. But while you're storing your bag, you can also clamp off your fluid line with the slider clamp so that the fluids don't leak out. So you would just clamp it with the slider clamp, and then when you're ready to use it, you would unclamp it with both. And now you should be prepared to administer fluids to your cat or dog. So here we have Mr. Miyagi. He's going to demonstrate receiving fluids. And first we are going to remove the needle and switch it out with a clean and sterile needle. So again, you're just going to push it onto the end of the fluid line and then twist up on the hub to secure it in place. Remove the cap carefully, and then it does help to have an assistant, but if you don't, some pets will tolerate having you do this on your own. You will pull up on the skin in between the shoulder blades, making a tent or a triangle. Insert the needle, and then after the needle has been inserted, open the fluid line with the roller clamp. And you can verify that the fluids are flowing by looking in the chamber and making sure that the fluids are dripping. You can also use the lines on the fluid bag to properly measure how much fluids your pet is receiving. So each line represents 100 mils. So you would just make sure you note where you start and when to stop. So as you'll see, we're giving Mr. Miyagi some treats to help him tolerate this a little bit more. But as we go, he does relax and accept some pets from us. And as your pet has fluids more often, they do begin to tolerate it more each time. And each pet is different. So some pets are fully relaxed and some may protest at first. So you'll see Mr. Miyagi is now kind of relaxed and just letting us administer the fluids. Now he is developing a hump on his back. That's exactly what you want to see. So that's just the pocket of fluids. And as the day goes on, that fluid pack may migrate to the front of their chest or their lower legs, and that's normal until the fluid has been absorbed. If you notice that your fluids are not flowing freely, if the chamber is not dripping, you can adjust your needle to allow the fluids to flow a little more freely. Sometimes as the hump gets larger, you have to pull out with your needle just a little bit so that the fluids can again begin to flow freely. And once you have given the full amount of fluids, you will remove the needle after roller clamping the line off to stop the fluids. And then once you pull the needle out, just pinch the skin where you administered the fluids gently. You can also use the paper towel to hold that off.